At the Hotze Health and Wellness Center, we see a multitude of guests who come to us because they're just sick and tired of being sick and tired. They've visited numerous physicians, often prescribed a host full of drugs, yet they never seem to get any better. More often, they feel worse. As the old adage goes, their treatment is often worse than the disease. Conventional medicine fails to help these individuals because it doesn't address their underlying health problems. Drugs are simply prescribed to band-aid or to mask symptoms. With me today is Connie Rankin and her physician, Dr. Don Ellsworth. Connie's here to tell her story of how she got her life back, and we're glad to have her with us today. How are you doing today, Connie?
I'm doing much better, thank you.
Great. Well, Connie, I want you to tell us just a little bit about yourself, your background, where you're from, how you ended up here in Houston, and then tell us about the problems that you had that ultimately led you coming to see us here at the Health and Wellness Center.
Okay, well, as I've said, I'm Connie Rankin, and I am a mother of a 36-year-old boy, and I have a 6-year-old grandson.
Much too young.
Well, thank you very much.
To have a 36-year-old boy. Very young. Somebody robbed the cradle.
Thank you. Well, you know, I came from Georgia.
There you go. Very young in Georgia, right?
You know, we marry young. So I have a 6-year-old grandson. I moved to Houston in 1972. And looking back, I've had problems with my hormones, it seems like, since I was 16, because I had some major issues with monthly, just PMS, everything. So, but
were you treated for that back then as a teenager?
No, back in the 60s and all that, they
live with it.
Yeah, you lived with it. You took, Tylenol or whatever you could take to try to help. And it progressively got worse. And I had my son in 1973, and that was the only child I could have. And, I went to the doctors. We wanted another child, but for some reason it just didn't happen. And so, looking back, now I realize that I probably had an imbalance in my hormones all along, but nothing was done. All they did was put me on birth control pills to help with some of the symptoms. And then when I actually started going through menopause, and when I was 45.
You started at 45?
45 years old, 45 years old, and I had some major, it was not a fun time for me. I had acne, severe acne, I had migraines, and it was just, and I knew it was all related to hormones because it would happen on a 30-day cycle.
So it happened cyclically. You'd have the headaches. You knew when you were going to have the headaches.
I knew exactly, and I would go to my family physician and and I would tell him, I'd say, it has to do with hormones. And I'm not a doctor, but I thought, it seems like this is, an easy diagnosis. But for some reason it wasn't. They kept saying, no,
it couldn't be your hormones.
It couldn't be your hormones. We have you on birth control. We have you on all this. It's fine. So I went through that for literally 10 years. I was on medication called Maxalt for the migraines, but it didn't get rid of the migraines. It actually just knocked me out. So it wasn't, it wasn't preventive.
You still had the migraines, but just didn't care.
Yeah, when you were asleep. So that went on for 10 years, literally, and it increased from once a month. Then it went to twice a month. I would get migraines until when I actually showed up here, I was getting them 2 and 3 times a week. I went to several.
How many physicians did you see?
I would say probably at least 8 or 9.
You saw 8 physicians. Mm-hmm. Were they OB-GYNs?
Yes. No, not all. I started jumping around.
So you saw OB-GYNs, saw your family doctor, saw OB-GYNs. Who else? You see a neurologist?
No, never saw a neurologist. But I was convinced at one point that it had, you're going to laugh, that it had to be because they were male, that they just did not understand my hormones. And so I started going to female doctors.
Well, that's good. Well, we find it very commonly. I'm just wondering, how many men do you think really understand women's hormone problems?
Probably 0.
Do you think if you give him a medical school degree and put him in a white coat, he's going to understand better?
Probably not. But I have to give credit to my best friend, Donna Rosenstein. She heard your talk show, radio show, and she called me at least 4 times. And she said, Connie, you've got to go see him. And I said, I was skeptical. I really was. And I said, nah, that's a lot of money, and I have insurance. And I, be frank,
Sure.
I thought, why would I do this? And she said, and I hope this doesn't come off wrong, what I'm about to say. She said, Connie, you would spend that amount of money on a couch and wouldn't even think about it. She goes, isn't your health more important? And when she put it in that perspective, it totally changed my mind. I thought,
Dr. Ellsworth, Connie comes in with this history, 10-year history of migraine headaches. Is this uncommon in patients and guests you've seen at the Hotel Health and Wellness Center?
Well, migraines are very common, especially in women, and of course Connie was right. It is related to the hormones, and much of the time when you get the hormones where they need to be, you see a dramatic improvement. And Connie's experience was exceptional in that it turned around so rapidly. But the approach that your doctors took was exactly what they were trained to do, and that's they heard some symptoms and they gave you a prescription that was based on what they had heard the most about, which was usually determined by the pharmaceutical industry's marketing. And so it has very little to do with what your body needed and everything to do with the pharmaceutical industry's influence over medicine.
So the Maxalt you're talking about is basically going to palliate the problem, but it doesn't resolve her underlying problem of the cause of the migraines.
And all the birth control pills, you were going in with your PMS symptoms. That had nothing to do with a birth control pill deficiency, yet that's all your physicians were trained to do. And really, men, women, they all sat in class and learned the same information, and when they were trying to help you with the tools they had, but when they looked into their toolkit, all they saw were drugs. They didn't have any way to think about, okay, what's wrong with Connie's underlying problem and how can I get her back into balance? We don't talk that way in medicine, and it has a lot to do because the things that balance your body are what normally belong in your body, and those are not patentable. So pharmaceutical industries have there's no incentive to get the person out there with samples and sponsoring a dinner and talking about progesterone.
Right.
And when you came in, you were taking Primpro, which we already know from the Women's Health Initiative is not good for women's health.
So you recommended that she eliminate the Primpro.
Exactly.
You put her on natural progesterone and some natural biased estrogen. What about an eating program? What did you?
Well, Connie, you had also mentioned that you wanted to lose weight, and that was another issue.
Right.
And and that's an issue that we all struggle with. I mean, we live in a toxic food environment, fast food nation. It's tough. But on top of all that, there's the issue of antibiotics are often used with infections that might have resolved on their own, and then of course from time to time we'll really have a serious infection that needs it. And you had some antibiotics.
That's true.
Well, antibiotics will allow some changes to occur in your GI tract, including the overgrowth of yeast. And I don't believe anyone had ever discussed that with you before. And we had recommended some changes, talking about, why don't you describe some of those changes?
Well, I'm not going to lie, it was a tough 45 days, it really was, but it was the best thing that I ever did. We gave up sugar for the 45 days. The thing that I really noticed was that I gave up soft drinks. And that I saw a big difference.
Yeah, were you on diet soft drinks?
Diet soft drinks.
Which contain aspartame, which is a neurotoxin. So you're getting off that, you're going to feel a lot better.
And I gave up all sweeteners. And so now I only use natural sweeteners. And if I do have sugar now, I can tell the difference immediately. It's funny how your body will notify you very quickly that you've ingested something that wasn't good for it. So I gave up sugar, everything on the yeast-free diet. I went completely by it. It wasn't easy, but I really owe it all to you and my best friend Donna Rosenstein for getting me in here, because I was a skeptic. I really was.
Well, Connie, I want to say this: congratulations to you for taking charge of your health. That's so important. It's an amazing story and really remarkable. And I know that there's thousands of people that are here. The story is going to give them encouragement and hope that they can get their lives back too. So
I hope they can, because I can witness this. It really does work, and I'm very thankful.
Well, thank you for giving us the opportunity to serve you. Thanks for joining us today.
Right, thank you. Thank you.
Well, it's New Year's, and we know losing weight is on the top of everyone's priority list. Coming up, Shelley Johnson will be back to share with us about 5 supplements that may be able to help you lose weight.